of mine, well, it's teaching me so many things, like how to love and how to lose and how to choose.
Well, hello, this is Linda Carbonell, and welcome to another edition of Walking Through Life. Today, I happen to have my favorite police chief, Chief Philip Caston. Hi, Chief Caston, how are you?
I'm doing great, Linda, and thank you for having me back.
Yeah, it's always a joy. And I understand that, Whitney, you are a social worker
Yes.
through HCRS?
Yep, so I'm employed through HCRS and then I'm embedded, so I'm at the police department full time.
And can you tell us how long you've been there and what your experience with it has been so far?
Sure. I've been with HCRS and the police department for about a little over 6 months now. I am not originally from the area, so I came out here for the job. And this is the first time that Hartford has had an embedded police social worker. So it's been an interesting experience to kind of mold the position to what the community needs. And it's been a process, and we're going through it, and it'll take a while to kind of get there, but we're doing it.
And Chief Caston, when would you know that a social worker would be needed for like a call, if a family member called or somebody themselves called needing help?
Well, there's two ways that we've approached it, and I think we've kind of evolved into a third way. One, as Whitney had mentioned, she is embedded with us, and fortunately we work very closely with fire rescue. As you well know, you visited the public safety building. We're all together, emergency communications and 911, police, fire rescue, all in the same facility. And it's not uncommon to find Whitney at a console in the 911 center and then move quickly to the front seat of a patrol car or the back of an ambulance to go with first responders to the scene of a call. And I think that's probably where we initiated the discussion and conversation with folks at HCRS about Whitney's position, because the larger part of our interactions with folks that are in crisis, or a number of our calls for service originate with folks that are in crisis. We're getting calls from family members, we're getting calls from neighbors and loved ones that are concerned because everything that they've done has not worked. And even individuals themselves that are experiencing a crisis. And whether it's related to some type of mental illness or an impairment or even substance abuse related, we needed that extra resource. We needed that extra member on the team. And having Whitney in her capacity join the team has given us an additional advantage. So that's one way. The other way is proactively. And I think that was when we initially entered our discussions. I know HCRS was looking at a way to reach out into the community a little bit more with their caseload. They have a certain number of folks that come to them for help. And then there's folks that need help but don't necessarily make it there.
Right.
And of course, those are often the ones that the police come in contact with, law enforcement and EMS. So when we look at it from that standpoint, I think we've advanced the process in those two areas. It's moving along. Whitney has been instrumental in helping us update our procedures and how we're doing that. And then the third piece is our partnerships. Not just working with HCRS and the families of folks that are experiencing a mental illness or impairment or crisis situation, but also with the other organizations that service those folks and that can help them. Whitney has helped us work much better with the Upper Valley Public Health Council. She's helped us increase our training capacity. We're now involved with crisis intervention training or team concept based on the Memphis model. We just completed our second training class with that. And again, that's a partnership with the Upper Valley Public Health Council and the NAMI group that is in this area and services the Upper Valley, and a number of other healthcare providers, Dartmouth-Hitchcock Medical Center, Mount Ascutney.
Yep.
And it's allowing us to build a more complementary team. And instead of necessarily being always reactive, we are able to do some proactive intervention, and it puts a couple more tools in the toolbox of our first responders, and we're very grateful for that.
And I think that's something that I'd like to say too, from personal experience too. I think, you know, because I have a mental illness too, and I think when way back when I first when the police first came to me, when something had happened or it had a crisis or whatever, it was a lot of fear. There was a lot of fear there, you know, because people talk about getting locked up or, you know, whatever. And I think with the work that I have done in the different areas that I lived, like California and here, California especially, they do have a social worker such as yourself that would be able to be with the police department, because sometimes it's easier to talk to a social worker first. And the one thing that my husband Ted, who has schizophrenia, he had the same fear, but you know, once he met the Hartford police and worked with you guys, and you guys knew you know, how to help him when he was in crisis, it really helped him to calm down. And that's something that I really like to say is, you know, I want people to know that it's not scary. It doesn't have to be scary, and you guys are there for us, you know, and to be as open as possible to this process. And I think that you guys are doing your part, which is so important for us. So, you know, one thing I would like to do is thank you for that. And I want to talk a little bit about some of the issues that come up. You know, I know with me, a lot of it was suicidal tendencies. And a lot of time, people like myself that have borderline tend not to ask for help, or they tend to just go ahead and do it and then react afterwards. So that might be something we can talk about a little bit, is how that works, how you'd be able to help somebody that may be in a crisis that way, that didn't think but did it anyway.
Sure, yeah. A lot of time when we're responding to incidences like that, I mean, you have to meet the person where they're at,
Yeah.
And just what is it that they need, and you're really just kind of getting down to their level and providing support to them, and then connecting them to the long-term resources that they might need to be able to help them through the situation that they're going through.
I think that's important too. But the one thing I want to make sure we do too is to educate family, friends, and neighbors. And oftentimes when neighbors are around and they see what's going on, sometimes that can, you know, when they get involved, that can make the situation worse. So that, you know, kind of wanted to speak to that a little bit too, is that how as a community can we support the police department as far as like being a community, as to know, you know, when we're supposed to not only call, but to actually try to help somebody. In my sense, it's often that it's better for the police department or somebody else to handle something like that than such as neighbors. So what's your thoughts on that?
I think we move at the speed of trust.
Yeah.
And that's a term that gets used an awful lot. And certainly when someone's experiencing a crisis, it becomes all that more important. And Whitney touched on that a little bit. For us, it's trying to slow things down. And I think that's good advice for family members as well. We live in a time and a place where urgency surrounds almost everything that we do. It seems like everything is important, urgent, immediate. To someone that's in crisis, a lot of times that's not the important thing at that moment. And as first responders, that's what we're trying to bring to the process. That's what our police social worker tries to bring to the process. And at points, that can be counter with some of the training that we've received and some of the things that we need to do to establish control and bring peace and order in other circumstances, which is why the training process has been so important for us. It's a balance, but it is about earning trust, and trust is so important in public safety to begin with. It's about using and working in a different manner to establish that trust, and recognizing that everyone is a little different and has different needs. The unfortunate thing is oftentimes family members will escalate situations as well.
Yeah, that's kind of what I'm talking about, I think, is how can we maybe let them know how to handle a situation until you guys can arrive or something like that. You know what I mean?
Well, and to start, and Whitney, please add in, I think that we're always trying to calm the situation. And sometimes it's best to give yourself some distance, calm down, try and talk in a calmer tone. And try and put someone at ease and at peace. You definitely don't want to lie to someone. And as soon as you can contact 911, and that's always what I encourage folks to do, call 911. It is an emergency. And fortunately, as I'd mentioned to you, our communications personnel are going through the same training with us, with the police officers in this process. And they're going to go ahead and they may keep you on the line. They may talk with you. They may try and talk with the person that's in crisis. It's going to depend on the circumstances. And they're going to get the closest police officer there. If you're fortunate, Whitney will come out with us at the same time. But if not, I'm very confident that our staff is very concerned and caring, and they have the training and resources and the empathy to approach each situation and try and help connect folks with the help, assistance, and resources that they need.
Right.
So it's always step back, try not to rush the situation, call for help, and we're going to get there and we're going to try and do the same thing with you. Because one good thing about the town of Hartford and the Upper Valley is there are a lot of folks here that want to help.
Yes.
There are a lot of organizations and resources. Linda, you bring them in and out each week on your show.
Yeah, that's...
Help is so close by.
It is.
There's no reason for folks to take that next step.
I know, but sometimes I can look at it sometimes as feeling like you're all alone, even though you're not, but feeling that way, and before you know it, just something happens, and that's what was happening with me until I learned that it's okay to ask for help before you get to that spot, and I want to talk a little bit to you, Whitney, about the social work part. I know that when I had worked with a social worker with the police department, I'd felt really bad about what I did. And it was so important to me to have somebody like yourself to come and say, well, hey, we understand, let's just talk for a minute. And that I can see is a big value for people that really need help, right along with the police department being there to support these people. And, and oftentimes I think that I felt that I was being judged when I wasn't,
Sure.
That was my problem. And other times, I can speak for my husband saying that when you're hearing voices or seeing things, you're not really actually knowing what's actually happening. So I guess that's what creates all the confusion and all of that. And I'm happy to hear that you all have training for that now. And it's really encouraging to me to see that we have this in our community right now, because it's such a need. There's homeless people with severe problems. There's veterans with PTSD. There's so many issues, and bringing a light to all of this through walking through life, and I just really encourage that you guys to come forward to talk about this too. I think it's very important. And my message to everybody is always, learn, know that they're not out to hurt, people aren't out to hurt you. They want to help you. And I think by doing the show that's what we're doing right now, is that, you're letting people know that you're there and that you want to help. And I think that's so important. I really do. And it's just close to my heart, really is. As somebody that's found recovery from mental illness, I couldn't have got there without help from people like you guys. I wouldn't have been able to get to the recovery part,
Well, and Linda, I think that you saying that is probably one of the most important things that we can take away from today's program. And that is, help is never too terribly far away.
No.
And even though you may think you're alone, you never really are.
No.
And I can tell you, having spent time in different places of the country and in my profession, there are a lot of good people here that are affiliated with important organizations like Whitney through HCRS. We have been very pleased with the outpouring of support and the number of medical professionals and mental health providers and other advocates that have stepped forward to join the team and help us provide the important assistance that our residents and our guests need. Because, as I think I told you once before, we do have other communities that like to buy folks that are in need and in crisis a bus ticket and send them to Hartford.
Yep.
Because there are good things going on here. And our community is a giving, caring community, and that includes our police officers. I'm very proud of our folks.
Yes.
And very grateful that Whitney has joined the team. and the work that they're doing along with Whitney and our communications folks and our paramedics and rescue personnel at the fire department.
Mm-hmm. Well, you know, and I think looking back for me, the last thing that I remember that cracked the egg for me to realize that you guys are here to help a lot was when my husband was having severe symptoms, and he was always uncomfortable around the police. He went and found a police officer to say, hey, I'm having a problem, I'm seeing this, I'm visioning this, and so on and so forth. And it was like, wow, you know, this really is changing. The world is changing to see that we are able to get help, but we just have to ask for it, you know, and I think that's important. And I know how hard it is for people to pick up the phone and say, hey, I'm having a hard time, I need some help right now. But if you allow that and you allow people to help you, the road to recovery is so much easier, and you make a lot of friends. And I've always looked at the police department, Hartford Police Department, as my friends, always looked at it that way. So in talking a little bit too about some issues as far as like drug use and co-occurring disorders and things like that, what's some of the things that you might be able to bring to a situation there with co-occurring disorders?
Well, like I had mentioned, in any situation, we're really just kind of meeting the person where they're at and what's kind of going on, what do we need to look at, and what is kind of the more immediate crisis that we need to address for this individual. And that's really just listening to where they're coming from and what is it that they need, and connecting them to the resources that are best going to kind of fit what's going on for them.
And I'm sure that you have help from the VA up here for veterans that
Absolutely.
may have PTSD or other mental issues going on. And I know that they've got, that there's a lot of support in the community now for not just people suffering from mental illness, but also from abuse and from whatever else might be going on in their life, you know. And I can't say enough how important it is that we do have you working on these situations. You know, it's like nobody should ever feel like they're alone and that there's no hope for them. And I think you guys obviously give some of that hope. You know, I think it's great myself. And when you talk about doing training, the CIT training,
Mm-hmm.
what is that and what does it consist of?
CIT is a 40-hour training that's for law enforcement, fire personnel, dispatch, and it really looks at different skills in terms of de-escalation.
Yeah.
They go through mental health training to some extent, kind of learning about different mental illnesses, and then we bring resources from the community in. So the officers have a contact person for these resources so that they know who to contact in what type of an emergency situation.
That's important. And oftentimes a lot of that has to do with like people that are homeless. You know, they need a lot of help. So it's encouraging to me to know that you have numbers like that you can help people, you know, be able to find help, you know. And I know HRS is a big help to people with mental illness in the communities.
Absolutely.
And stuff. Yeah.
Yep.
Yeah. That's a great place, you know.
Yes.
And I think for us, it has gone beyond having a phone number to call. And with many of our partners, we're on a first name basis.
Mm-hmm.
And I think that's what drew my attention to CIT and why I had asked Whitney to help us with that. It was very successful in the 1980s and in Memphis where it originated, and it's spread across the country. And each community makes it a little bit different to meet its needs, and but it still relies on that around the same basic structure. And we're doing the same here, but it's about working with folks, being on a first name basis, and essentially loading the bench. We have a full bench on our team. And a lot of folks and a lot of different specialties to bring to the table. And that partnership is very exciting. And we're able to accomplish a lot through it. And the public should have confidence. And certainly our folks that are in need, and knowing that when they pick up the phone or that they need to call on us, that we have a full team to pull from.
So it's you know, family members, people that are concerned, friends, and actually individuals themselves. It's more like thinking to yourself, well, I know I need help, or I know my child needs help, or I know my neighbor needs help, but I can't do it. But we have a wonderful police department. We have a wonderful social worker. They can pick it up where we can't, and really help somebody. And that's really super encouraging. It really is, to see that and to know we got that. And I'm sure it gives comfort to people such as myself that do have mental illness, to know that we have officers and social workers and everybody that's willing to help us. We don't need to have a fear. I mean, maybe back in the day we did, but nowadays we don't have to, and it's just wonderful. And if somebody is, I know that HRS has an 800 number too, so in
Correct.
case somebody's in crisis, they can call the 800 number to get to talk to somebody who, then if it's known that they may need extra help, then oftentimes they can call themselves by somebody just suggesting that maybe they need help. A lot of doing that too.
Right, absolutely. The 800 number is there, so individuals can call and get the support that they need, either over the phone, or if some level of care is needed in terms of having a mental health assessment done, to consider if hospitalization is needed, or other possibly inpatient resources. A member from the team will come out and do an assessment and provide support that way as well.
And I think by doing all this, though, we are fighting the big stigma, because there is a big stigma out there about having a mental illness, and mental illness is just so stigmatized. And I'll share this with you. I had somebody tell me, you know, because, you know, obviously I've talked a lot about recovery and all of that. And when I told them I have a mental illness, the thing to me was, shh, don't tell anybody, because, you know, people don't want to, you know, they don't understand that. And with me, I like to think of it as more as, you know, this is a health problem. You know, it's like anything else, you know, and the way you fight stigma is just to bring it out and talk about it. And that's what we're doing. And I think it's so important. And I think it's made a big difference here in Hartford to have people willing to listen and be willing to help. So I'm really encouraged that you guys are going that next step to do that.
We're very grateful for the support we've received from HCRS and George Karabakakis and his staff, Catherine and Kate, that helped us put the position together that brought Whitney to us. I have to give them all the credit.
Yeah.
They have been very, very helpful in doing that and accommodating us and working with us in the process. And just, I can't say enough good things for the assistance that they've given in making this position a reality, and certainly we could not have asked for someone better to fill that role than Whitney.
And you've been doing this now for 6 months.
Yeah, I did similar type work out in the Chicagoland area.
Yeah.
But
so you
I've
must
been
like
here.
this. You must like this work now.
I do, yes.
Yeah. Doesn't it give you a good feeling to be able to help people?
Absolutely.
You know, yeah, it does. And you know, I found Hartford community is the same way. They just want to be so helpful to people, and it's just awesome. White River Junction area is just so supportive of so many people that have problems, whether it be mental health, addiction, or homelessness, or you know, just needing food or whatever. And so I'm encouraged with that too, you know. And I want to know, is there anything else coming up next for the CIT or the police department as far as mental illness goes? Anything adding or?
The Hartford Police Department is going to be training all its officers in CIT, and eventually then looking at putting together a CIT team within the department.
Oh, nice. That's great.
And we are committed. It's not just our department. We're working with a number of the police chiefs in the Upper Valley on both sides of the river in Vermont and New Hampshire, which is why we've received the funding support from the Upper Valley Public Health Council in making that a reality. And our hope is to establish a regional team. I know Lebanon Police Department was the first to pursue CIT, and they've had an active process there along with the mental health court for some time. So we're very excited to have their support. They've helped us get moving. And I know that as we continue to grow together, the process will grow and become fine-tuned, if you will.
And
We also, and before I forget, I'm sorry to interrupt, Linda.
That's okay.
We have a partnership, or we've partnered with the faith community. A local church will be coming forward over the course of the next couple weeks. We'll be making an announcement and having a chaplain join us that has some
Nice.
specialized training in crisis as well as addiction recovery, and we're very, very excited about that.
Yeah,
Uh,
that's great. I mean, that's just added. You know, I'm just so encouraged to hear everything that's going on. I've never said that there wasn't anything out there for myself or for people that that are mentally ill. I've never said that, but oftentimes I had my blinders on and I could see nothing. And then once you start looking, you can see it, you can find it, and you can have hope. And you have, if you're willing to open up a little bit, there's people right there for you. The police department, the ambulance drivers, anybody, the hospitals, the doctors, all you need is just to take the glasses off and just see that it's there and see that help's possible, but also that you can help yourself by asking for help. Often that's hard to do. You can help yourself more by asking, And I know that's hard for a lot of people, but I am so encouraged. I've heard wonderful things from people in the community and people that are having a hard time that they're getting help, and that's just so important. It really is.
Absolutely.
And that they know that people love them and care,
Well, and Linda, and we'd always encourage someone if they feel comfortable enough to come to the police department and introduce themselves before a mental health crisis occurs, so that the officers can get to know them and how to best serve them when we are responding to that crisis.
That's a good idea. Just come up and talk a little bit about the symptoms they might have.
Absolutely.
Yeah.
And
what works for
they
them.
know works for them, exactly.
Exactly. That's a good idea.
And I'll tell you, if a good opportunity coming up on June 2nd is the Hartford Community Coalition is having their annual block party. And we will be set up there, and they'll be able to come by folks in the community and meet a number of people throughout the area that will be setting up and participating in the block party. But the police department and the fire department will be participating as well, and would love to meet anyone that would like to come by and meet with us. And it's the evening of June 2nd.
June 2nd. Now, where is
Lyman Point Park,
Lyman Point
behind
Park.
Town Hall.
Behind Town Hall. I'll be there. I'll come down and see
Look
you.
forward to seeing you.
Yeah, that would be great. Come down and check everybody out.
We'll have our new K-9 team there too, Linda.
Oh, yeah. They got to meet the K-9 team. You're supposed to bring him, or maybe I'll bring the camera down there and meet him down there. That'd be cool. That would be cool.
We'd love to have you.
Yeah. So is this what you would, because earlier you were talking about a dunking machine? Is that it?
Well, we'll have to talk about that in the future, Linda.
Oh, I guess he ain't going to tell us. That would be good. No, I wouldn't do that. You're just too nice. I couldn't do it. I couldn't do that. Could you?
Probably, yeah.
Yeah, she could do it.
When it's for a good cause, I'm willing to sit in the tank.
You are?
Yes.
Oh, you heard that, didn't you? Good cause. Just come up with a good cause. So is there anything else that we've missed about what's happening at the police department and through you, Whitney?
Linda, I think we've hit most of it. Just encouraging people again, that we're really there to help. It's not that we're trying to get anyone in trouble. We're really just trying to connect them to the resources that are best gonna to fit their needs.
And I like the idea of people going to the police department to talk about symptoms and what can make them feel more comfortable.
Absolutely.
It's important. It's like my husband. He says the best thing that helps him relax is country music. You know, and me, it's my teddy bear. You've heard me talk about my teddy bear. So I have this stuffed bear that goes with me everywhere, unless I'm doing a show or something. I haven't brought him here yet, so. But yeah, we all got something that helps us feel a little bit comfortable. And it's nice to know that other people have things that make them feel comfortable too. So,
absolutely.
Yeah, and it's great that we could share that. We could bring that and and share it with you guys and share it with everybody. Just share what makes us feel better.
Yep.
So I know another tool for me that I often use is meditation music that sometimes works on bringing down stress and things like that. So there's little things like that. You know yourself, but nobody else knows. But
Yep.
isn't it great if we can let everybody know what it is that helps us feel better?
Absolutely.
I think
I'm
that's,
like your husband. I like a little bit of country music.
yeah. Willie Nelson, that's it. Willie
You
Nelson,
come by
John
my
Cash.
office anytime and you'll hear it rolling in the background.
Yeah, that's good. Yeah. Well, I've got so much out of this, and you know, like I said, I think people that that not just need help services, but people that maybe want to be helpful or want to help people or to understand people. I think they can learn a lot from you guys, and you know, like letting people know what helps them in a crisis or in a situation that may otherwise be uncomfortable for them. So I think that's important, is to be able to educate people. And this is the way you do it, right?
Yep.
Yeah, for sure. Well, I'm hoping that, okay, so we did this your first 6 months. I'm hoping to be able to do it again soon so we can find out how the rest of the year goes for you and how you like it and how it's going for you too, Chief Caston, and, you know, all the new training and things like that are going to be coming up.
Sounds good.
Yeah.
Always enjoy visiting with you, Linda.
Oh yeah, we love visiting with you. We might give you a little hard time, but that's just because we can. That's because we can, right? Well, anyway, thank you guys for coming and talking to us today. This is an important subject, and it's near and dear and close to my heart. And I'm just really encouraged that you are all in working on this and helping people, and I think in a sense helping yourself to better understand people. And I just think that's so important to be able to do that. And it's a gift. It's truly a gift. And in turn, I think we ourselves as a community want to understand you too also better. So I think it's great. I think I know all the officers now by name, I think. It's pretty good, isn't it?
That is good.
Yeah. Even if I do come up there with my hair all crazy, nobody tells me until I get the camera back and look at it. Ooh, they didn't tell me my hair was sticking up there. That's okay, though. So anyway, thank you both for being here today. And this will be part of the Mental Health Month series on Walking Through Life. And, of course, it'll air several times after that, too. But pay attention. If you didn't see it the first time, it will be on a couple of times, and if you do want to see the show again, you can always call CATV, and they will air it again for you. We're going to call it Hartford Police, what do we want to call it? Hartford Police CIT program, or
Hartford Police Update.
Hartford Police Update.
That
There you
works.
go. We could do this one as a Hartford Police Update.
Or Community Mental Health Resources.
That's even a better one, Community Health Resources. I like that one too. I'm gonna have to write that down though so I can put it in the editing. So anyway, thank you guys very much, and we look forward to seeing you again soon, and keep us up informed and let us know if there's anything we can get out to the community so they can learn more. That's what they like.
Thank you, Linda.
Thank you.
Thank you. So anyway, this is Linda Carbonell. We're saying goodbye for today, but we'll see you next time on Walking Through Life. Bye-bye.
Walking through this life of mine, well, it's teaching me so many things, like how to love and how to lose and how to